Tonight, the saying a pain in the neck may be a joke to some, but for others, it can mean giving up what they love to do and being forced to live with the agony that comes along with intolerable neck or arm pain. Tonight, meet Sergeant First Class Paul McKinnon. After injuring his neck in Iraq, he came home and tried several treatments to ease his pain. It wasn't until he heard about neurosurgeon Dr. Stephen HYSELL and a new artificial neck disc that he finally found the relief he needed. Now he is back to work with the Army National Guard without pain and with restored motion that allows him to ready the tanks for the troops.
While serving in Iraq, Sergeant First Class Paul McKinnon's Humvee hit an embankment and flipped over. Besides bumps and bruises, he somehow hurt his neck.
While in Iraq, an operator overcorrected on his vehicle. We hit a berm, shot me up into the roof, and then we shot across the road, hit the other berm, shot me up into the roof again, and then in doing so, it collapsed my neck. And at the time, it was just a sharp pain. I didn't realize the actual significant damage that had happened.
Once Paul returned from duty in Iraq, his neck pain became almost unbearable.
About 6 months after the actual incident, it took that long to actually take effect. But when we came back home, that's when most of it got really severe.
For 3 years, Paul dealt with the chronic pain until an MRI revealed degenerative disc disease. His neck injury damaged the outer part of the cervical disc, allowing disc material to push on a nerve root, causing him pain in his spine.
Oh, I could hardly move my neck. It was like it was just locked up with a brace on it. It was just that bad. And when I did try to move it freely, it was just miserable.
After several unsuccessful treatments with physical therapy and injections, Paul was referred back to a military hospital out of the country where he was going to have to leave his wife and family again for treatment.
I didn't want to go back over there as it was a 4-month process from the time I left here until I got back home. And so we discussed it if there's anybody in California that can do it.
So Paul found and was referred to neurosurgeon Steve HYSELL at Community Regional Medical Center.
It's a horrible injury that could be prevented.
Dr. HYSELL had performed hundreds of spinal surgeries, but this one was different. A special procedure allowed him to implant a newly approved artificial disc that is inserted into the neck.
The actual approach to the operation itself is very similar to a traditional anterior cervical discectomy and fusion, except instead of placing a graft into the disc space, we place in the artificial disc. The traditional method that we use for degenerative disc disease during the surgery for an anterior cervical discectomy would be to remove the disc themselves, place in a graft within the disc space, and then fixate the spine using a titanium plate.
Dr. HYSELL was the first to perform an artificial disc implant at Community Regional.
The artificial disc is basically composed of two pieces. It's made out of stainless steel. The top portion has a ball, and the bottom portion has a trough. There are 4 screws that hold it in position, 2 for the top portion and 2 for the bottom, with a locking screw for top and bottom. And basically, with the trough and ball design, it allows for motion to occur in a normal physiologic way. So it's not like a standard hinge. It allows for forward motion with the trough design.
It is the first artificial disc approved for the cervical spine by the U.S. Food and Drug Administration. The design allows for an up and down center of rotation, meaning the disc is designed to better match the motion of a naturally functioning cervical spine.
The initial benefit of having an artificial disc versus a fusion is that the patient does not have to wear a collar. They maintain motion within that segment, and the theoretical advantage would be that you may not require a second surgery from a breakdown of the levels above and below where you normally would have a fusion.
The Prestige cervical disc is proving to be an effective and safe treatment for many patients.
Yes, it's extremely important in my job to be able to move, because I have to be able to get down in positions to point parts of the vehicle out to the vehicles or what needs to be changed. Say like these tractions arm on the back of the tank over here. I've got to be able to get down and show them exactly how to remove it, how to place the jack up in there properly, how to place the dog bone in there to roll the tank back to get it up in there properly if they've never done it. So yeah, and before I couldn't even get down on my knees to even go to even look at it. So there is a huge difference.
With more than 200,000 people suffering each year from this type of disc problem, this new procedure offers patients who qualify more options.
If you've been fighting neck pain or even back pain, you need to get it fixed, because if you don't, you're going to live miserable, your family's going to be miserable. There's a saying, if mama's not happy, nobody's happy. Well, I was making my wife extremely miserable, and it just, when you get it fixed, your whole life changes. Everything around you, your attitudes that come back to you, it's just, you're crazy if you don't get it fixed. There's no reason fighting the pain.
We salute you, Sergeant, and your fellow guardsmen for the work you do for us every day. And we're happy that you found Dr. HYSELL and the artificial neck disc. For more information on this disc, log on to our website. It's medwatchtoday.com.